Hello and welcome to another episode of Corgi Town, USA. I am Candy. In my lap is Chuckles, our spokescorg. We also have the full Corgi committee here. That is Mortimer Barnabas, Little Booger, our senior lady, and Tito Bandito, the baby of the family. We typically have Kat, our co-host. She had some scheduling things that she had to take care of, so she's not with us today. So you just get me and Chuckles. But we're here for you every week, all things pet parent lifestyle, corgi centric, but really for all of you dog moms and dog dads out there. I'm a trainer, so we talk about training. We also talk about grooming, traveling with your pet. So if you're new here, hi, welcome. Thank you so much. If you enjoy this episode, please like and subscribe. We are here for you every week, all things corgi and pet parent lifestyle. And Chuckles is always happy to meet his fans. So if you go to any of the big corgi events, we would love for you to stop by our booth and say hi. So anyway, this week we are going to be talking about veterinary services. We have had a couple of episodes in which we've had veterinary professionals on the show, and we've talked about different things. I will reference, I believe it was season 4, where we had the good doctor from the Vetsplanation podcast, and he told us sort of what it is if it's an emergency versus can you wait till your regular vet is open. We've talked about that. We've also had Dr. John Waterhouse talking about rehab. So we have sort of focused on animal health and what that means to have our pets healthy. So I was excited to bring on a new friend of mine. We've been training with her little Aussie Reese, little adorable little puppy. And her name is Kristen Andrews, and she is a vet tech of many years experience. So we're going to talk about different type of veterinary clinics, what to expect, and kind of get some perspective on that. So Kristen, welcome. Thanks for joining us.
Hey, thank you.
Yeah, we appreciate you taking time out of your busy weekend here to kind of educate us, give us some perspective.
Yeah, totally.
So let's start with the different types of clinics. So just from your point of view, if someone says, oh, I'm going to go to the vet, that's a pretty blanket term, right? It's kind of good to know the different types and what to expect.
Yeah, it's definitely not just your little country clinic that it used to be. So there's there's GP, just like in humans. We have urgent care that there's popping up everywhere now for like our middle ground, not necessarily like super critical emergencies, but obviously they're open on the weekends so that, if your dog does have a really painful ear infection,
Or cough.
yeah, kennel cough, UTI. I think some of the urgent cares do surgery around here too. And then I don't know if they would take care of something like a ruptured spleen. That would definitely be more of an emergency. So you've got your more critical cases like emergency, and then there's veterinary specialists too. You've got dermatology for animals, vet neuro, internal medicine, cardiology, dental specialists, surgical specialists. Just they've gone beyond just the typical 8 years, and they've done residency to be more specialized veterinarians because there are, there's been a lot more research going on for our pets. So more things are known. So we need more specialized things so that we can get those problems taken care of. But I'm in GP. I've been primarily in GP for almost 16 years. I did work at dermatology for animals for a little bit. I also did a couple relief tech shifts over at vet neuro. That was super cool to see the MRI on a couple patients.
Yeah. So
Yeah.
you got to be part of that diagnosing like IVDD, degenerative
Mhm.
myelopathy, some of the kind of spinal.
Yep. I think like meningitis too. Yeah. Anything if the dog or cat's, mainly hind end going out all of a sudden, where they can't walk or seizures, things like that. If there's something at the GP level that we can't figure out, we'll refer to vet neuro, or if, other specialty areas, if our typical line of stuff at my job, if we're just nothing's working, then we'll refer you to any of the specialists that we think your dog or cat needs, and kind
Yeah.
of there. Yeah.
And that dictates kind of the type of testing you can get, right? Like you talk about
Yeah.
neurologists, they're going to be doing things like MRIs. Some of your veterinary care, your emergency veterinary care clinics are going to have different types of testing modalities than like your GP will, right?
Yeah. So, and they'll have, I mean, there are there's some emergencies around here that are associated with some of the neurologists. So they might have availability to do a CAT scan real quick or something like that.
Oh,
Or,
that's good to know.
yeah, I think it's
Yeah.
Eureka maybe in Mesa that has a CAT scan. I can't quite remember off the top of my head, but there's so many, so many new ones out there now. So,
Yeah.
and then just, you know, I think a lot of the times, it's not, you can't just go to your regular vet anymore and get everything, fixed. You know, we'll try, we'll definitely try.
Sure. Sure.
At a certain point that there's, you know, there's the specialists for a reason, and they definitely have more training than, and that's what they've gone to school for, is the more training. They have to do residencies and go through even more testing at the end of their residency. I think some of them have to write, you know, I don't even know how long their papers have to be, but they have to like present to the board and all that type of stuff. So it's
Yeah.
a lot more extensive than GP.
Yeah, for sure. And I think we've talked to a behaviorist before on the show, Karen Deeds, and one of
Mm,
the things that she said that is just, I think about it every day, especially doing dog training, is dogs are in the middle of an evolution right now. So
mm,
we are in the middle of their evolution. And so when we think back 20, 30 years ago, before you even existed, right?
yeah.
Dogs lived outside, maybe in the
Mhm.
backyard. Every now and then you would have a toy breed that kind of lived the spoiled lifestyle, but that used to be the exception.
Yeah.
Now it's more the rule. And I tell everyone to be compassionate with their dogs because we've kind of taken all of their instincts and shoved them into a box and expected them to hurry up and learn the way we live, right?
Hmm. Yeah.
Which is, if you look at it from their point of view, that is very difficult to do. So
Yeah.
knowing what what you ask of your dog specifically. But I think that one of the beautiful things that have happened out of this revolution is that we do pay close attention to things. It's not just stick a band-aid on it, take
Hmm.
an antibiotic. Now it's, well, there could be a problem here that's treatable, but we need to know to look into it. And we need someone who studied that facet of this particular part of animal health, right?
Hmm. Yeah. Yeah. And like, even at which I've learned so much over the course of 16 years, my first clinic, you know, I thought steroids were just gonna fix everything. And to a certain extent they do, but you can't be on them long term, or you have lots of side effects from them. Um, we will get the occasional client that's like, you know, that wants to just do that. And it's like, well, to practice good medicine, we can't do that. So there are alternatives to steroids for certain things. And, you know, long term palliative care, we use steroids. But if it's a young animal, we're going to find alternatives for that. Um, so, yeah, it's kind of just
Yeah.
GP's a lot different than it used to be.
And the
Not
philosophy is a little different sometimes with your older veterinarians that
mm-hmm.
kind of grew up into that are still in practice
Yeah.
versus some of the newer ones that come out. And that's not my area of study. And I think somebody who's gone to maybe a vet for many years that did try to treat everything, that can probably be shocking to someone who
Mm-hmm.
hasn't heard that before, right?
Yeah, yeah. And like, I mean, even when I was growing up, when my parents didn't take our animals to the vet very often, only
Right.
if something bad was happening, you know.
Sure. Yeah.
Um, and so when I started, I was like 16 when I started. I was like, oh, we should have been doing a lot more all along. But you know, we had a
That's what research does for us.
yeah,
It's what
we
years of
had a ton
research
of
does.
animals, and it was just, you know, one of those things. Our parents would get us animals for birthday or Christmas presents. And like my sister got a pair of parakeets one year. We had no business having parakeets because we had 6 cats in the house, and it's like,
Oh goodness.
yeah, why did we do that? But so I think definitely too, just people in general have been more mindful of like the type of animals they get for their lifestyle, which is good. So I think, before you even get an animal, research obviously the breed, and then if they are going to need more specialized care, make sure that you have a specialist in your area. Just like Frenchies, they might need a neurologist sometime in their life. They'll probably need a specialist of all kind in their life, honestly, but
well, the brachycephalic dogs
yeah.
tend to need kind of focused care, we will call
Yeah,
it. Yeah,
definitely. And then we're lucky enough to have a vet at my hospital that knows how to do the soft palate and nares surgery. So we've had a lot more uptake in our Frenchies at my clinic, just because people want to do that surgery while they get spayed or neutered, or even if later in life they'll have the soft palate and nares done so that they can breathe better. And
Sure.
they so much better after they have that surgery. Like that should just be just a standard of, if you get a Frenchie, this is basically what you need to do.
And I've read a little bit about this. My specialty is more corgis, but when we talk about dogs like Frenchies and from some of those type of dogs that have that type of snout, I guess they didn't used to have as flat faces. It became fashionable. So it became where they were bred that way.
Yeah.
And then it took us a while to figure out, oh, this is problematic. And so I've actually read that there's some preservation breeders out there that are actually trying to get it back.
Yeah.
To where they can actually breathe it, right?
Yeah, right.
Yeah.
Because it's like, if you can imagine everything from a normal nose, nothing's like nothing in there is actually shortened. It's just kind of all shoved in there. And so you've got that soft palate hanging down and basically occluding their airway. And then just their nostrils are too small, so they can't get in enough air. And that's why they're panting all the time. And after surgeries, they're holding on to their endotracheal tube for way longer because they're like, oh, I can breathe now with this tube in my throat. So we just let them have it in there as long as they want. But
nice to know there's a solution, though.
Yes, there is. So yeah, I kind of got off topic there, but
it happens to all of us here.
Right.
Welcome to Corgi Town, USA. We tend to do this sometimes.
Wait a minute.
But I feel like that was helpful. I mean, what you were telling us about, different types of clinics, when to go to where. So if we can dig into that a little bit, just to kind of earmark where you were telling us, kind of educating us about different types of clinics. And so we know that if there's an acute emergency, obviously always go to your nearest ER. We're not telling you who you should see and when, but if it's something that is critical where your dog is non-responsive, then obviously that is the closest emergency clinic you can get to, because time is muscle. Or if they've eaten something, which there's poison control, and I've shared that number on several of our episodes in the description box, and I can share it again on this one. It's on speed dial on my phone because I have 4 corgis that think they're starving all the time and eat everything. But if you could kind of tell us what, maybe just a couple of common examples of ER versus specialist versus GP.
Yeah, so like GP will do mainly wellness exams, vaccines, which are in those wellness exams. We'll do ear infections, UTIs. If a dog is coughing, like kennel cough, or coughing for other reasons, around here, valley fever. And then usually older dogs, getting into heart disease and stuff like that. We have capability for x-rays, in-house lab work, and sending out blood work for more specialized testing, like the valley fever, things like that. Some clinics have higher end ultrasounds. We're working on that, but
Cool.
We have our ultrasound mainly to briefly make sure we don't see a mass or fluid in the abdomen, like a bleeding spleen, because we'll get dogs come in, they're pale, they're just not doing well. And we're like, let's just make sure there's no splenic mass real quick.
Or a foreign body.
Yeah, yeah. Um, so we'll do, if we suspect a foreign body, we'll do barium testing, or we just send out our radiographs and we'll get a radiology report back and they'll be like, yeah, there's a foreign body in this section of the intestines or whatever, or in the colon. It should pass if it's, well, not going to say it should pass in the colon, depending on what it is and
Right.
where.
We just went through that with Mortimer. He likes to eat his sister's poo. And so we have to be really good at picking it up. But sometimes if she goes on the rocks, he goes out and seeks what might be left of the rocks. So he had some rocks in his belly.
Yeah.
And we had to do the x-rays and look, and we could see them. And it was a wait and see game to make sure they actually did come out. We got lucky. They eventually did.
That's good.
Yeah, just went through that.
Yeah. So yeah, we're at my GP, we're able to do quite a bit actually, but like at my first GP, we were out in the country and it was just me, the vet, and his wife, and so and I would say it was old school. So we would refer to some of the bigger clinics and specialists a lot around there, but now where I'm at, we're definitely able to do a little bit more. And then you've got urgent cares around here now that are more open. Usually they open, I would say, around like noon around here, so that they're able to stay open until like 9 or 10.
And those are good. So if your vet doesn't have any available appointments that day, but you really want to get them seen sooner than later, not necessarily life and death, but sooner is better, that kind of thing, right?
Yeah. So, especially if you're not able to get there during work hours, they're at least open a little bit later, and they'll be a little bit cheaper than ER still. And then
just like people hospitals. Yeah.
Yeah. So it's kind of like, human urgent care. You can take your dog or cat there, even if they are like have flu-like symptoms, pancreatitis, kennel cough, really bad ear infections, pretty much the typical things. I don't know if I would go there if my dog's like in respiratory distress or anything like that. I haven't actually been in an urgent care, so I don't know if they would just go ahead and be like, okay, go on to ER. They might stabilize the patient.
They're limited in the care they can provide at an infusion center. Yeah, that makes sense.
But I'm sure they have like x-ray capability and, labs and all that stuff that GP does. Just, on a more urgent basis. There are some around here, I think like Urgent Vet or Crown Urgent or something. They have an online wait list, so that you can just. Yeah.
We've been there too.
Nice. Yeah.
Somebody ate something.
So you're not waiting there for hours. They'll give you like a half an hour heads up or something like that, which is nice. But I definitely, for emergency wise, unless you absolutely can't get anywhere else, I wouldn't take my dog there for like an ear infection, because that's going to be a very expensive ear infection that could definitely wait until Monday morning, unless they're just like, which is very rare, like bleeding from the ear or has like so much pus in there that they're just super painful or something like that. That's an ear infection that's been left alone for a long time. But there are some ear infections that are caused by animals getting foxtails in there. So that can kind of start brewing pretty quickly. So in that case,
and sometimes requires surgery, right?
Yeah, usually we have to sedate them because it's pretty painful. There's been a few dogs that will let us get them out awake, but it's not fun to try to do it while they're awake. So there's different price points with any different clinic. Specialists in emergencies going to be the greatest cost. So I definitely recommend getting pet insurance when you get a new puppy, and it can start helping a lot for just at least wellness stuff at your GP. And then Depending on the plan, it can cover a good amount of emergencies and things like that. So definitely, especially on the breeds that are prone to more, I guess, more foreign bodies and just overall more health issues in general.
The ones that eat everything.
Yeah.
Yeah, totally. Had a few of those myself,
Yeah.
over and over again.
So far, no
So
foreign bodies for my dogs. They just shred paper towels and eat.
big fun,
Yeah.
big fun, Mom. Big fun. So let's talk about, thank you for sharing that with us. I think it's very helpful. I would like to talk a little bit, let's talk about the estimate. Because
Yeah.
I feel like this is kind of when sometimes we feel like the tone changes. Like the pet parent kind of can tend to feel like they're being sold or trying to be upsold.
Yeah.
But from your point of view, these are important tests to get done for the diagnosis. So I would love to hear, like, from your perspective, where that's approached, kind of help give, pet parents out there some healthy perspective on it.
Yeah. So, yeah, going over pricing is the least fun thing of my job. I would obviously love it if, prices weren't involved, but, the staff has to get paid and we have to keep the lights on somehow. And I definitely get the comments of, oh, we're probably paying for your car payment or something like that. I'm like, well, no, not really. But
Yeah.
um
It doesn't go
so
straight to your pocket.
yeah, no, not at all. So, sometimes if, I present someone with just a wellness, if we did absolutely everything at their wellness checkup, yearly checkup, all the vaccines that we offer, all the yearly blood work that we offer, and anything else that they might need, because there's some times that we do recheck radiographs at their wellness appointments. Like if they're in heart disease, we'll just do some recheck stuff then as well. Things could be already over my paycheck on that estimate. So,
Right.
um, you know, um, but the estimate, you definitely don't have to do everything on the estimate. It's just for us to present you with all the recommendations, and basically it's more for charting purposes. If you decline something, we can put it in there, and because you do get the clients that come back and are like, well, you never offered it, and it's like, yeah, we did, but and it's right here. So it's more for just and then for the next person, if a client declines something now, but they want to do it later, we can see what tests we were recommending, so that we're not hunting through everything to be like, which lab panel were we wanting to do and all this stuff. So it's just more helpful for us. And then going over like dental estimates, sometimes that's hard because dentals are expensive, but they're we do the same level of care as human dentists, so our dental prices are about the same as human. And it can get really expensive, especially for the dogs that have grade 4 tartar. Their teeth all might need to be pulled that day, or at least half their mouth, or and so just a typical dental, straightforward, could be anywhere from 600 to 800. But then if they need any extra anesthesia time for those extractions, it can get up to, I've had some lately, 1800, 2000, just because they need lots of extra anesthesia time and meds to go home and things like that. But that's paying for our technician time, the doctor time. The technicians are right there monitoring for that whole hour to 2 hours. We've got them on IV fluids the whole time, keeping their blood pressure up, keeping them hydrated. So we definitely, at my place, we have more monitoring and things like that than just like small, like mobile surgery units, things like that. So the mobile surgery units are, they're able to do things cheaper because they might not be doing radiographs for, the mouth to see If there's anything broken in the root or abscessed or things like that, they're just doing a straightforward cleaning. And so that's why it's a lot cheaper there. And then, so that's always a fun estimate to go over, but,
Yeah.
cause, that's definitely like on average, it's one of our more, pricey things, but, you
Well,
know,
and you don't know, sorry, bear with me
no,
here.
you're fine.
You don't know what needs to come out
Yeah. Yeah.
until you've looked at the graphs, right?
Yeah. Cause, we'll kind of gauge the tartar if the dog will let us look in its mouth, on exam while they're awake. There's some dogs that just, they have to be muzzled and they won't let us anywhere near their mouth. So typically I'll give them a range because I'm like, well, you're an older Chihuahua, so you're gonna probably need some extractions. So I always just tell people, this is like worst case scenario. It could be way lower than this, but just go ahead and plan for this, unfortunately. But and we tell people too, if you want to call before extractions, we can always call you to let you know about how much longer it might be, just so then you can decide if you want to go forward with it or not.
Sure.
But
So
usually, yeah.
go ahead.
Oh, but yeah, I mean, for the most part, everyone wants it just taken care of while their dog's under anesthesia. You don't want to have to do that twice, especially for an abscessed tooth or broken tooth that can cause problems in the future and things like that. But then you
It
have
helps you get in front of that, right?
yeah,
Helps you get in front of it. Yeah.
yeah.
And so in short, I would
Mhm,
say that a lot of that is covering your end of it. So as the
mhm.
clinic, you are simply making sure that you did cover the bases because you want that patient to get the best care.
Yeah,
So
yeah,
if it does seem lofty or like too much, it's because you don't want to miss the most important things.
yeah, yeah. And we have everything on there if they need meds. Usually there's no surprises with the estimate because we've got everything that could possibly be needed on there. So, and day of surgery, we have the client sign them. We have them sign a anesthetic drop off form. Just to cover our everything on our end. But um, and so yeah, it's difficult going over estimates, but it's what's needed to know what the pet parent wants to do, and we definitely don't like doing it. But
Sure.
there are options, not that it's good to take out a line of credit, but there's care credit that's offered. I think it started out like in human dentistry, and now you can use it with veterinary services. I've heard people even using it for their Botox. So
Okay.
yeah, I had a client. He's like, "Oh, just use the care credit. My wife opened it for this reason." I'm like, "Oh, okay, cool." But
All right.
so there's definitely options out there, because we don't offer payment plans at my place just because in the past it's been offered, but then we don't get the payments or
And there's
get
overhead. There's
yeah,
overhead for somebody to monitor it, to make sure that
yeah.
the books are balanced, and yeah, so
Yeah,
that makes
it's just
sense.
a lot. And, at my first clinic, we used to let people pay with check and those would bounce. And
No.
there we couldn't let that happen very often because even I think he didn't pay himself very much at all. Like he was maybe bringing in himself 50 grand a year. And that's definitely not what a doctor should be making.
Oh, what a kind soul.
Yeah, so but yeah, so
Well,
yeah, if there's
thank you for sharing that though. I think that's, again, I always say like perspective is everything. And
mhm,
I think it's important for us to know as parents, because I've heard that before. And the narrative is a little bit different. So if I go to my vet who I have lots of history with, they
mhm,
know my level of, parenting and care and what I want to do. And that I'm usually willing to do anything that they recommend because
yeah,
mine are my children.
yeah,
Um, But we have longstanding history there. And so not only is there a big file and the vet techs there know my dogs and know their histories, it's going to be a different conversation than when I walk into a new clinic, an emergency clinic, or maybe another clinic because I need something after hours. The narrative looks different. It's okay, well, this is how much it's a little bit colder, and it's not their fault. It's a different type of conversation. So I think it helps us to hear from your perspective being in the industry. Like, look, we don't want to miss anything. We
Yeah.
want to try to throw as much at this as we can to be sure that you're getting the best care for your pet. And in
Mhm.
order to do that, we kind of have to offer a wide swath of possibilities.
Yeah. Yeah. And as far as like different like I was just thinking like diagnostic wise, if there's certain things that we can just try medications for first, but if those don't work, then we definitely recommend going that next step for diagnostics. We definitely don't, at least where I'm at, we don't force diagnostics on anyone. Obviously, highly recommend so we can figure out what's going on with the cat or dog. But if they're not like in distress right then or anything like that, they're stable, we can try some medications first. Even if it's just for limping, like we'll be like, okay, just try a week's worth of some anti-inflammatories and pain meds. If it doesn't improve, come back. We'll do some x-rays, things like that. So yeah, we try not to like push any of that on anyone. So I think that helps a lot too. There's some clients that are just like, go ahead and do it all. Like they just want to do it while they're there, which is great. And then other ones, we just take it step by step, which is totally fine. There's definitely certain things that I know, but just being in the field for a while, I'd be like, no, I'll just try some meds first. Like she'll probably be fine. But I have access to being there almost every day and be like, I can bring my dogs whenever. So,
well, in the years of experience,
yeah,
kind of what you've seen, what you think you can expect.
yeah,
My vet calls that aggressive medicine, which I kind of get tickled because every time we have an issue and we're in there, I usually say do it all because I
yeah,
don't want to miss anything.
yeah,
And I definitely don't want to be the one responsible for having my pets suffer longer than they need to, or them not getting quick care quick enough because I decided I didn't want to do something.
yeah,
And so she says, you do aggressive medicine. That's what she says. That's what she says to me all the time.
that's
Because
funny.
it's you and you do aggressive medicine.
But that's good. And we do have quite a few clients that have pet insurance, so they're just like, yeah, just do it all today. And I'm like, okay, cool, that was easy. So
Yeah.
that obviously makes my life easier. I don't have to
Sure.
feel. I don't know. I do feel not guilty, but it does make you. I don't know. It's hard.
Empathy.
Over
It's empathy.
prices. Yeah.
Empathy. Yeah. It's compassion because
Yeah.
most of you that work in an industry are pet parents also.
Yeah.
So you're also feeling the pain of uncertainty and maybe watching the animal suffer and
Yeah.
wondering what's going on and trying to find the right treatment. I mean, I think that's what we call compassion fatigue, right? Everybody that works in any kind of capacity where it takes, you have to have a lot of empathy and you have
Yeah.
to have a lot of compassion. It can wear on you a lot, which is why your industry is a hard one to work in
Yeah.
because there's a lot of that. And you get it from all angles. You get it from the one in which you're speaking and what you're talking about, having to have the compassion and knowing how everybody feels. And then you have to have those hard conversations. But then also you get people that don't understand. And then they come at you with this sort of kind of attitude that doesn't really help anybody, but they don't understand and they're coming from another point of view, and you have to deal with that. And I would love to kind of brush on that briefly.
Yeah.
If you can, you've told me some stories off camera. I would love for you to share a little bit about, if you feel comfortable enough, if you don't publicly understand. But I wanted to put in this episode, I think it's good if we just have to remind everybody, and I feel like most of our listeners here at the Corgi Town show do show our vet staff lots of kindness and compassion because we care so much. But just a reminder to be kind to your vet staff because they do deal with a lot of this. Most of them care about your animal, the care they're getting, and about you and how it's affecting you. And if they come across as not that way, then there's probably other reasons. But
Mhm.
most of the time they're fighting their own battles in their
Yeah.
own right.
Yeah.
So I'd love for you to kind of kind of tell us a little bit about what you dealt with.
Yeah. So, I would say like at my first clinic, there wasn't, too many like threats or anything like that. It was more of like, well, I'll just go somewhere else then. It's like, well, okay. You only come in once a year just for a required rabies vaccine anyways. Like we know literally nothing about your dog. You spend $18 here a year. So
Right.
it would definitely just be like there it was more like arguing about having to get a heartworm test when there was a lapse in heartworm prevention and things like that. And if people back in Indiana knew what prices were here, they'd be just blown away. Because I looking back, I'm like, our prices were nothing compared to
And
what it is now.
for context, and it's higher everywhere. But for
Yeah,
context, for anyone listening, we have listeners in different countries.
yeah.
So here, Kristen is here local to where the Corgi Town show is near Phoenix, Arizona. So here in the American Southwest, we have very high fees and bills. Yeah.
Mm-hmm. Yeah. So like our exam fee back in Indiana was the highest it got to was 40. Here it's 80. And like our heartworm test back home was I think like 28. The vaccines range from like 18 to 22, somewhere in there. So I think our nail trims were like $10 or something like that. So just that's kind of the range. Our dentals were only like maybe max $200, but we didn't have a dental x-ray machine. So if a tooth happened to fall out while we were cleaning, or if it was like super loose, then we'd pull it out. But we
Oh,
had no,
look at extraction.
yeah, we had no way of knowing if, a root was broken deeper down or abscessed or something like that, which
Wow,
is fine.
200 for a dental. Wow.
Yeah, I kind of remember something like starting in the 120, 150 range. And then if a dog had obvious extractions, it might have gone up to 200 with like all the meds and stuff too. Yeah, is crazy. Um,
Amazing.
but compared to cost of living, I did get compensated more there. Just that's I'm fine being transparent with pay and stuff like that because I think vet staff deserve more, and
Absolutely.
um, we put up with a lot. Definitely just emotionally and physically, like my back is done for after
I'm sure.
getting up and down off the ground all these years, just holding dogs in weird positions, things like that. I'm actually going to a massage appointment after this because I'm like, I can't.
Oh, well, that's good though. That's
Yeah,
good self-care.
yeah,
Good
some
self-care.
self-care.
Yeah.
I used to just suffer through it, but I'm like, no, I gotta do something.
Yeah.
But yeah, here it definitely, I think people more expect the prices here, just you know living here and things like that. But we definitely have had people threaten to shoot up the place over minor things.
Not the
um,
PQs. Not the PQs.
it hasn't happened recently. It was probably
Mm,
about
mm.
4 years ago, something like that, like day before Thanksgiving too. And I'm sure everyone has things going on in their own life. I've had a lot of things going in my own life, but I don't you know threaten people.
Don't
um
resort to violence. Yeah,
yeah,
which we
there's
hope no one would, but it
just,
happens.
I
Yeah.
think everyone, if you're an angry person like that, you need to have an outlet somehow. Not maybe not guns, but that's a whole different thing. Um,
Sure. Sure.
so a lot of it's just, or an animal's due for a yearly exam. It's like, no, we can't prescribe antibiotics without seeing it. Like, one, we don't want to create antibiotic resistancy because that's a big thing now.
Mhm.
Um, but two, legally, we have to see you once a year. It's just legal thing with Arizona and, standard practice too, just so we can keep tabs on the animal too, just like human med.
I don't think I knew that was the thing here. That's good to know
Oh,
that in this state that it's you have to be seen once per year.
yeah, I don't know like
Because I know
how.
the rabies is 3 years.
Yeah.
There.
Once you get boosted after having it once, then it's 3 years. But and rabies has to be given by a doctor, so there has to be a doctor's appointment associated with that. But so a
Well,
lot of
and vaccines, and I don't want to get too far in the weeds with this, but
yeah,
I think it's important to be said that getting vaccines at your local clinic, I think, is the way to go.
yeah,
Because I've heard a lot of, I hate to say the word horror stories, but I've heard some things not go well with people trying to vaccinate from going to like a feed store.
mhm,
Since you can
yeah,
purchase them there, you can purchase the different types of vaccines. And from what I've been told is they're not often handled properly,
no,
which means they can be degraded.
hmm
So it's, to me, I'm too nervous to do it. Like I want someone who has needle experience poking my dog. I don't
yeah,
want to do it. But I think that's just important to say there. Like I am of the opinion that I think you should go to your veterinary clinic to get vaccines.
yeah. And I've in a pinch, I've gotten like a tetanus vaccine for my horse. She cut her eyelid on a rusty metal feed bin a few years ago. It was a Saturday, and I was like, I'm not paying an emergency vet
But
fee
you have
for that.
experience.
But
You
yeah,
also have experience.
and
So
I
that's a
would
little bit
say
different.
like the vaccine costs isn't much different like at Tractor Supply. Like, and I would pay that extra few dollars for the, making sure that the vaccines are put in the fridge right away and things like that, because that's, they have to be refrigerated. You can't leave them out for a certain amount of time. If they're mixed up and we don't happen to use it in that appointment, they have to be used in the hour or we throw them away.
Mhm.
So I don't know. Yeah, I mean, I'm hoping that, people um, handle things well at the feed stores, but you just don't know. You don't know what goes on in the background
It's
when
definitely not paid
when
attention
their
to
shipments come in. Yeah,
as
um,
closely. That's what I've been informed of, or I've
yeah,
been told that before.
yeah, and
Yeah.
once if they've been sitting out for a while, I don't know what the vaccine reactions could possibly be.
And you
Um,
lose efficacy.
yeah, and we
But
send out reminders too, like, hey, your yearly's coming up. And if you're on a medication that's lifelong, usually we'll approve another refill to get you by until your exam. Like we're not gonna like cut an animal off cold turkey or something like that. But we just can't keep prolonging it long because a lot of these medications also need recheck blood work with it, like for thyroid or
well, and the steroids.
yeah,
My senior is on steroids, so
yeah,
we staved off having her on them for her mystery autoimmune disease we think she has.
yeah,
And we staved off and we staved off and we staved off. And I've noticed that she started to slow down. Her quality of life was waning. And
yeah,
so we made the decision, let's go ahead. This is palliative at this point.
yeah,
Let's make her
yeah,
comfortable. And
uh,
boy, is she comfortable. She
yeah,
is in this roid rage now.
yeah. Oh gosh.
Yeah. No, it's good though. It's good roid rage. I'm
Okay.
starving. Where's the food? And I'm ready
Right.
to go get to it now. We don't have the hesitation. So
But yeah, so and yeah, it's just the receptionists definitely get the brunt of I would say like verbal abuse from clients. I feel like it has died down since we've put our little sign up in the clinic. Basically, we will not tolerate any verbal or physical abuse or whatever. Just, be kind to our staff, whatever. I forget what the sign
but it
says.
makes me sad that has to
Yeah.
but it has to be said. But I think again, it's perspective is everything. I think you coming on here and educating us on, kind of what it looks like from your world
Yeah.
is so helpful for anybody coming in to kind of have that frame of mind. Like if
Yeah.
we remember the other person we're talking to is someone else with very similar worries same and different battles, and approaching with compassion and understanding. You're always going to have a better conversation, always.
Yeah. And, if there is something, we do sometimes happen to get emergencies come in, or, more critical things, and we'll try to stabilize them. It's just, that pet parent's worried, and we have to remember that if they are kind of getting not aggressive, but agitated or whatever. And it's like, so you just have to learn how to like calm down the situation. But if things like escalate, it's like, yeah, we're not going to tolerate that. And then, just from our end and in the back, day to day, we're going from euthanasias to then a puppy room, then, a weird disease room. So we're just like all over the place emotionally.
Sure. Yeah, roller coaster. Yeah, roller coaster.
So it's bound to happen that maybe one of us will have a slight attitude if we're just tired or something, but we definitely try not to.
Special people. I mean, you have to check a few boxes. You have to be not only good with animals and pets and all the different things they come with, but also know your craft, right? Know how to be good with the needle, know how to use constraints when necessary, know how to make animals feel more comfortable in your presence, but then you also have to be good with people.
Yeah.
And that is fielding those, objections and fielding some of the different types of spirits that you get.
Yeah.
Right?
And I think a lot of us in vet med are empaths, so we definitely take on all those different feelings, and it can definitely be a lot. By the end of the day, it's like all the girls will just be like, why is the vibe so off? Because we're probably all just like, we've got all these just different, not different personalities, but just different emotions are going on with ourselves, and then the clients throughout the day, the vets, and
right.
Yeah, it's been a rough few weeks, the past few weeks. I'm not really sure why, but it's just been weird with different personalities and stuff like that. So
a lot of stress going on in the world.
Yeah.
Can bring out the worst.
Yeah. So.
But you have a massage to get to, so I don't want to keep this any later. Yeah.
I know. I can keep going on and on and on, but
we'll have you back on. We'll have you back on.
Yeah.
These are good conversations to have.
Yeah, I'll think of some more stuff and.
Yeah. But we'll wrap it up for today. We'll
Okay.
let you get your woosah, get your
Right.
breathing, get your massage.
I'll try to just fall asleep during it.
And it'll be wonderful.
Yeah.
But thank you for sharing. And if just anybody who's listening, viewing, thank you so much for being with us. And we hope you enjoyed Kristen's perspective. I certainly did. Again, I think perspective is everything. I think it's helpful to know, kind of have our minds wrapped around the different types of clinics we can visit, because I don't think most of us think of those in that terms. It's we're going to go to the doctor, right? We're going to go to the vet, and we're going to get seen. Okay, well, what's the problem? How critical is it? Who can we see? When can we see? What can we wait on? When can we not? Where should I be going? So I think that's very helpful. And then just the reminder to be kind, be compassionate. These are all very caring people that are caring for beings that are very precious to us. And I think we can all go a long way with a little bit of kindness and compassion.
Yeah.
Well, thank you so much, Kristen. We appreciate you so much. Hey, you enjoy that massage.
Yes. Thank you. I will.
And tell Reese he's a good boy.
He is a good boy. He's just laying on the floor in the doorway.
Wonderful.
Yeah. He's
all
like,
right. He's living the good life.
Yes, we'll see you soon, and puppy graduation day.
Yes. Can't wait. It's always a good time. Well, you have a great rest of your weekend, Kristen. Thank you so much.
Thank you.
Bye.
Bye.
Well, again, I hope that you liked this episode. They're not always this heavy and informative, but we do like to bring you information. We're here for you every Thursday, all things pet empowerment lifestyle, Corgi centric. I'm here, Candy, with the Corgi committee, Mortimer, Tito, Booger, and then Chuckles, our spokescorg, here in my lap. We will see you next week.